Today, Sheetal, the technology is such, anyone can look 30 all their life, right? It doesn't have to be going under the knife. It could be just going under the needle. So in India especially, I think the time has come for our national medical commissions and medical councils to be setting out guidelines on who should be doing what sort of cosmetic surgery. So we always tell our patients this, किसी को भी cosmetic procedures करवाने की ज़रूरत नहीं है. You don't need to get it done. But do you want to get it done? It's a want-based procedure. It's not a need-based procedure. Even mental health with relation to cosmetic procedures. Are you letting it control you? Are you doing the cosmetic procedure to feel better, or is it controlling you? The title of the paper was, is your phone camera making you choose more cosmetic surgeries? Okay. Is the selfie that you're undergoing changing your mental connections or neuronal connections? Are you becoming addicted to the dopamine kick that a like or a comment is giving you? And that's a real problem with social media. What we do owe to our patients is to make a procedure look like a procedure and not make it appear like granny's magic pill. You'll go in for surgery and you'll come out having a new nose. It doesn't work like that.
Hi, this is Sheetal Shenoy and you are watching Pinkvilla. Now, let me tell you a word that's going to bring a lot of thoughts in your head. Cosmetic surgery. A lot of stigma attached to it, a lot of taboo attached to it, but I have with me, joining in a conversation, someone really special who is going to debunk everything and give us a glimpse into the world of healthcare and Bollywood glamour. Let's welcome the one and only Dr. Debraj Shome. Hi.
Thanks, Sheetal. Thanks for having me here.
Anytime. You know, before we get into a conversation, I must say that all the accolades that you have with you, it's amazing, because cosmetic surgery or a plastic surgery is such a topic that is not spoken about, right? There's no transparency. So I must say that Dr. Debraj is the American board certified in facial cosmetic surgery. Let me tell you, he's the only surgeon from Asia. He's also the governor at large, American College of Surgeons, India chapter, fellow American Academy of Cosmetic Surgery, General Secretary, India Society of Facial Plastic and Reconstructive Surgery, and he's also the director at the Aesthetic Clinics, which has multiple centers all over India. And he's also the friend to a lot of Bollywood and Hollywood celebrities. So how are you doing?
Good. Thank you for having me here. How are you doing?
I'm doing great. So excited for this conversation, I must say that. Just to start off with, as I mentioned earlier, when you say cosmetic surgery, there's a lot of stigma attached to it, right? A lot of Bollywood celebs accept the fact that they have done it, but a lot of people also hide it because there's no transparency as such. So as a doctor from your end, what is the kind of needs that come up from Bollywood celebrities when it comes to cosmetic surgery?
Do the Bollywood celebrities really accept it?
Some do. I know that some do, not taking names.
Most of them are growing younger only through yoga.
Facial yoga.
They're only growing younger through yoga. We are those stigmatized doctors who are never recognized as at any of these parties, right? Yeah. There will be folks and friends who will send us messages on WhatsApp. And they'll be like, बाद में बात करता हूँ तेरे साथ. अगर आके हाय बोल दिया तो लोग पूछेंगे क्या करवाया तेरे से. So no, I don't think it's. I still think there's a stigma attached to cosmetic procedures. See, to me, it's like this. Everyone would like to look better.
Yeah.
Would you like to look better?
Of course.
Of course. That's true for everyone in this room. Everyone probably on the planet. And as disposable incomes become more available, India becomes a richer country in terms of GDP, people will do all those things which gives them quality of life. Looking better is part of a normal thing that every human being would want. Our face literally goes out with us every day.
Yeah.
Unlike our dresses which can hang in the almirah, our face goes out with us every day. Even if you're doing makeup, it is some form of a cosmetic procedure because you're trying to make yourself look better. When was the last time anyone ever put up their pictures on Instagram without any filters?
Yeah, and then they just say hashtag no filter.
Absolutely, but that's the way it is. Yeah. But yet, hypocritically, each one is judging the other one. अरे वो देख वो बहुत young लग रही है, उसने कुछ तो cosmetic surgery कुछ तो करवाया रहेगा. But कुछ तो करवाया रहेगा तो हर कोई कर रहा है ना. अगर फर्क ही नहीं पड़ता तो सब पत्ते पहन के बाहर घूमने चले जाते. But we are trying to look good, we are trying to be well turned out, we are trying to make sure our skin is even, we are doing makeup, then why the stigma? Why this unnecessary thing about I don't want to do certain things or I have never done certain things, making it appear as if it's some sort of a caste system. Those who have done something are actually in a worse place than those who haven't.
Right.
Look at all the celebrities today. Would you agree that 60 is the new 40? There
At least looking at them.
There are some folks
Right.
who are 60 years old and definitely look better than the yesteryear stars in their 40s. So obviously there is something which is happening. If it was only yoga, then all the athletes should also age similarly, because the athletes are probably in better shape than any of the celebrities so-called will be, right?
Yeah.
But they are not. It clearly means there are procedures being done. Today, Sheetal, the technology is such, anyone can look 30 all their life, right? It doesn't have to be going under the knife. It could be just going under the needle.
Yeah.
It could be just an injection. It could be just a laser. It could be just these wonderful devices which cause collagen formation in your face. There's so much happening. And I think, trying to demean any of it is to take away choice. We are a democracy because we have the right to do certain things with ourselves. And I think we shouldn't take that right away from anyone.
When you just mentioned this, the collagen, the word collagen, right? It's so used often that you see skincare brands coming up with newer products every single day, and there's so much variety out there even for audience or the general customer to use it, right? So do you think all this, when you say you do a cosmetic surgery, and is that it, or is there a healthcare procedure that needs to be followed up, say eating healthy or eating food that gives you that supplement of collagen to your skin? So is it like that, or is it just surgery is enough for it?
So it's like this. Obviously, not everyone will age the same.
Right.
Why do we age in a certain way?
Lifestyle?
It depends on our genetics. First and foremost, our genetics. It depends on our environment.
Okay.
It depends on the type of food we eat. It depends on the type of exercise we have. Obviously, you can't expect a coal miner to have the same kind of aging that someone living in cleaner air surroundings will have. So all of that matters. After that, you start applying skin creams. You start applying sunscreens. All of that make a difference in aging as well. Why are we aging actually? We are aging because of two things. First, there's a breakdown of collagen in your face. And that breakdown of collagen is akin to a building breaking down as age or getting dilapidated as age comes over. And as you have this breaking down, you have gravity which is pulling everything downwards. So essentially, anything which causes collagen formation in the skin would be a good idea. Sorry to disappoint you, but most of the skin creams which claim to create collagen in your skin do just what they are supposed to do, bullshit. They don't do any of that. So if you have to deliver the collagen, how do you deliver the collagen? It's going to be either devices which force the skin to produce collagen. The skin normally does not produce any collagen post the age of 30. So it forces the skin to produce collagen. Second could be fillers, which are basically an injectable variant of collagen which is being injected below the skin. If eating collagen or just a skin cream was enough to develop collagen, every meat eater who eats collagen or eats meat should be having a lot of collagen in their body, which is not the way it works out.
Right, yeah. And talk to me about the history of cosmetic surgery. Now with the advancement of technology, how has it grown and what is the way forward?
Cosmetic surgery is becoming more and more common. And when we say cosmetic surgery, it's not only about those who will undergo a nose surgery like a rhinoplasty or an eyelid surgery like a blepharoplasty. In fact, if you start early, how old are you, 16? So when you start at 16 and you start undergoing treatments at 16, there's a very good chance that at age 46 or age 55, you will not need the surgery. If you've done your fillers earlier, if you've done your injectables earlier, you've used your sunscreen better, you will just continue to age better, which is what we are seeing, that a whole lot of people are aging far better because of their food choices, because of what they are using and getting treatments earlier. It's like basically if I did 45 minutes of exercise from the time I was 16, maybe at age 45 I can still have six-pack abs. However, I've let myself go and become a 150 kg human being, and suddenly I want six-pack abs, then it might need something more drastic like a surgery at that moment in time. So it's really a conundrum. It's basically what you can do to slow down aging and to look a better version of yourselves. All of that anti-aging stuff could actually be clubbed under one genre, which is cosmetic surgery, even though you might not go under the knife.
Wow, that's a new thing that I learned today. Talk to me about the celebs now, since you've done a lot of cosmetic surgery for Bollywood and Hollywood celebrities. Just out of curiosity, I wanted to know what is like the need that they come up with? Like, what is the kind of brief that they give you before the surgery happens, and what is the entire process like?
In general, if someone's giving you a brief on what to do, we would prefer not to touch them.
Why?
Because then that means that they have already sort of colored their thinking as to what they would like to look. Look, the most important thing is to look natural. You will always turn around, look on TV and say, वो कितनी funny लग रही है, उसके lips कितने बड़े हो गए, बहुत filler करवाया होगा. But you're not looking at the other 100 people in their 50s and 60s who are looking younger. Obviously, they are also getting something done.
Right.
The only difference is the choices that they are making with regards to procedure. So, less is more.
Okay.
You don't want to do too much. And if you've taken care of some of these people right from their youth, they will come to an age of 60 and 70 and never require surgery. It will just be a 1 in a 2 years sort of a touch up with either fillers or skin peels or skin care or the various other injectables or the devices which are available, which will make them look wonderful all throughout. For instance, you now have machines available, which can help you work out your ab muscles 15 minutes a day, and that itself can just be a pad which is applied to your stomach. So for all practical purposes, you could be reading a book, and this is getting the workout of its life just by being made to contract with all the electrodes, etc. Is that cosmetic surgery? No, it's not. But is it a cosmetic procedure? Yes, it is. So there's a multiple number of things which can be done. The interesting thing is, as this has become more and more common, what happens is people who want to look better usually can pay a premium for that.
Right.
When people can pay a premium for that, it means that you're able to charge a little bit more than you could for other facets of medicine. And when you do that, then there are all sorts of people who want to get into that. So today you will have literally, I'm telling you, the person you're getting your skin treated from, you should look at their credentials.
Yeah.
You may not be sure who's treating you. I know salon owners who are doing injectables and fillers. I know all sorts of people. So in India especially, I think the time has come for our national medical commissions and medical councils to be setting out guidelines on who should be doing what sort of cosmetic surgery. How should cosmetic surgery training occur? The truth of the matter is, something like a hair transplant surgery, none of us are learning in our medical schools at the present moment. So getting that oriented, making sure that goes in a particular way, and accrediting people will make this entire environment safer. Especially as I'm not sure if you are completely aware, India is the 5th largest destination for medical tourism for cosmetic procedures. So therefore, it would work really well if we could have an accreditation as well as all the other things which drive safety and efficacy go hand in hand.
Right, that is so important, right? Because as you mentioned, you can never trust, right? And what if it goes wrong? So when you say this, so we look at the ratio of the procedures that have been a success and that have failed, right? So when you compare this, according to you, what is the ratio likely right now in India?
98% success, 2% failures. But India or any other person on the planet remembers only the bad things. Remembers only the bad things.
Yeah.
You remember only the trauma in your life more than the happy things which happened in your life. And that's life. So every time you turn around and say a filler, no, I don't want to look artificial. Look at how she was looking when she did the filler. But hello, what about the rest of humanity which at 60 is looking like 40? Yeah. None of that is happening, or all of that is certainly not happening due to yoga. So obviously the thing is, choosing the right practitioner is important. Choosing the right technology is important. Now, in the US where I trained, there are board certifications which are related to cosmetic surgery alone. Whether you came out of a dermatology background or you came out of a plastic surgery background, you have to specially garner training in cosmetic surgery after that. You know why? Because the typical cosmetic person who's undergoing a cosmetic procedure is not even a patient. It could be someone like you or me who wants to look better than we are looking. We don't have a disease. It's not like having burned skin where we have a disease and need treatment. We look fine and want to look better. So the risks actually in you which can be taken have to be lesser. because you will not take even 1% chance of looking out of the ordinary or having a side effect just because you're undergoing a cosmetic procedure. So accreditation becomes critically important in driving safety and efficacy, and in ensuring that every aesthetic practitioner who comes out meets a certain global standard, has been trained in the usage of things, and is being held to a particular level of efficacy or accountability in the procedures they are performing.
Yeah, true. That is so true. You know, while you say this, doctor, I wanted to understand, just out of curiosity, that sometimes this entire process of surgery and everything is not so much for a physical appearance, but it's more for the brain, right? Like, you just in your head, you want to look more prettier and stuff like that. So how do you overcome that, and what's your take on it?
I call facial surgeons like me the neurosurgeons who operate on the face. We operate on the face,
Right.
but what we are impacting is inside your head.
True.
So we always tell our patients this: किसी को भी cosmetic procedures करवाने की ज़रूरत नहीं है. You don't need to get it done, but do you want to get it done? It's a want-based procedure. It's not a need-based procedure. If your crooked nose is impacting your confidence, and we know life is a confidence game. How confident you feel is all within. But if every time you look at the mirror, if you don't want to go out because you have a crooked nose, yes, we can set it right. So you're absolutely right. Sometimes when you straighten a crooked nose, or you remove a very prominent mole, or you remove the eyelid bags, or you just make the skin look more even, what you are impacting is a person's confidence. And how do you quantify something as abstract as that? So we are the neurosurgeons who operate on the face. That's what I say always.
That's lovely. You know, I want to ask you another important question. You're also the governor at large by the American College of Surgeons, right? Can you share with us how important this role is for you, and how has it changed the dynamics in the field of cosmetic surgery?
I was very privileged and honored to be appointed as the governor at large of the Indian chapter of the American College of Surgeons. The American College of Surgeons has, I'm told, about 90,000 surgeons globally who have the report to the ACS, and to be appointed as the governor at large for India with 18,000 surgeons is something which was amazing. It's something which makes me feel very responsible. The objective of the governor of every country is to make sure that surgery training in every country goes to the next level. Indian doctors and Indian surgeons have always been counted to be amongst the best on the planet. Even in the US, where I was training, a number of university heads were actually brown-skinned people like us who came from India. Okay. And so from that perspective, having that entire role and using it to train especially the younger surgeons who are coming through is something that I really look forward to. So it's a responsibility, and I hope I'll be able to fulfill it.
I'm sure. It is very inspiring, actually. You know, let's talk about things that go beyond aesthetics, right? I want to understand from you that while we have these options of getting a surgery done, how important is an overall well-being for a person?
I think the overall well-being, without that, no amount of surgery can help.
Right.
So for instance, when we are using fillers, filler injections, the filler does not last the same extent in every human being.
Right. So what does it depend on?
It depends on your metabolism.
Okay.
It depends on how you're exercising. It depends on what sort of diet you're taking. Obviously, the breakdown of collagen, if we look at two 30-year-olds, may not be the same in both people.
Right.
You may look at someone and say you look only 20, you may look at the other person and say you look 40.
Yeah.
So personal habits are very critically important. Genetics plays a role. What you smoke, what you drink, the discipline you live under, whether you're eating early or late in the evening. Now, I have been a big proponent, I've been an ex-professional bodybuilder. And so as a professional athlete, you get used to living life in a particular way.
Yeah.
You get used to having your final meal at 6:30 or 7 in the evening. You get used to sleeping a certain way. All those things definitely make a difference.
Yeah.
I mean, it's not like you don't want to go ahead and take care of the basics and then cosmetic surgery can set everything right. Even the cosmetic procedures we perform may last better in you, provided you've had a healthy base to rely on.
Right. And how important is mental health in all of this?
Very important, right? As we think, so we will become.
Yeah.
So from that perspective, mental health is very, very important. In fact, even mental health with relation to cosmetic procedures. Are you letting it control you? Are you doing the cosmetic procedure to feel better, or is it controlling you? We meet patients all this time, or consumers who suffer from body dysmorphic disorder. They are forever wanting some change or the other. They have gone to an extent. We have people who come in and actually measure their nasal tip and say, I want it 1 millimeter smaller, with a ruler, literally.
Oh my God.
If you let anything become an obsession, it's a little bit of a problem. So mental health is the most important and critical thing. In fact, 30% of the patients in whom we refuse surgery, it's because they are under some form of mental stress or depression, etc., which needs to be treated first for you to be happy. If you're not happy and you're sad, just having better breasts is not going to make you any happier than before. So from that perspective, it's very important to ensure that your mental health and your physical health are actually in a proper shape before you undergo any procedures.
Yeah. And you do convey this to the
all the time.
All the time, right? Even the celebrities?
All the time. Okay. All the time. You meet people who believe, for instance, now they are out of work.
Yeah.
Right? And or they have aged a little.
Okay.
And they feel that if they do the procedure, they'll get the work back. I turn around and I say the best looking person on the world may not be the most famous celebrity. Yeah, the biggest actor of them all, the biggest star of them all may not be the best actor. A lot of it is related to the way the universe is giving you what you're supposed to get. In some ways, I'm also a very fatalistic human being. I believe कि मिलेगा तो उतना ही जितना किस्मत में है, irrespective of how your face ends up looking.
True.
So don't overdo it. Don't get into the phase where you're like a cat chasing its own tail and you're doing procedures more and more because you're just hoping that something will look better. In fact, some people go the other way. Of course, that's true. They'll get some fillers done, then they'll get more fillers done, then they'll get more fillers done, then they'll get more treatments done until they look completely different on television than they looked before. In fact, they look like better versions before, and many people are wondering why did they pay to come to this stage. But that's a disease. That's being obsessed. That's like an obsessive compulsive disorder. That's body dysmorphic disorder. They would rather need your empathy rather than your snide comments. Right. So I would request you to show empathy and them to understand what they are doing to themselves, remove all that mental perception and all that drift, and concentrate on trying to make themselves mentally stronger. Ultimately, everything will only work if you're mentally stronger.
Yeah, that's true. You know, while you say this, we have this new term, right? Not a new term, but it's being used so often right now, which is the unrealistic beauty standards, right? See, back in the days, I'm not sure if plastic surgery or cosmetic surgery existed back in the days, right? But slowly you see that it's coming into limelight and people are opting for it, whether they're celebrity or not. But then you also have the other part of the world where people are like, no, these are all setting standards for unrealistic beauty standards, basically, right? So does this act as a challenge for you as a doctor?
All the time. So we actually had this paper, which was published in one of the top American journals. The title of the paper was, is your phone camera making you choose more cosmetic surgeries? Okay. Is the selfie that you're undergoing changing your mental connections or neuronal connections? Are you becoming addicted to the dopamine kick that a like or a comment is giving you? And that's a real problem with social media. So that's the other side of it. You have 16-year-old people who are coming in and want, for instance, voluptuous lips. Do they even understand what voluptuous lips look like? Yeah. Right? So as a result of which, of course, there's a certain peer pressure which is coming in. Right. But you know, that's not the fault of a cosmetic procedure.
Right.
See, you have the internet. You could use the internet to commit the deepest frauds on the planet. You could use the internet to educate yourself on the planet, right? How you use the internet is up to you. How you use social media is up to you. If you're going to allow social media to run your life, if you're going to use the phone camera purely on the phone and not even bother talking to people on the phone, that's your problem. That's the misuse of technology rather than the use of technology. And in such cases, obviously, they should have a psychological counseling. In fact, if you look at the negative comments, at least on me on the internet, it's about how I am a prick, I think someone called me, who makes people undergo psychological counseling, but probably they don't understand that it's for their own good. If all of us keep on splattering paint on a painting, the painting is going to look really disorganized after a while, and this is your face, it's not even a painting. So why should you go through that, in trying to look better?
True, true. When you just mentioned this, I want to know, once you do a surgery, can you go back to being the
Problematic, problematic, difficult. It's a one-way ticket. That's why we would prefer non-surgical procedures, because non-surgical procedures will anyways last for a finite amount of time. Surgical procedures, you would need to do another surgery to come back. You went from Mumbai to Kanyakumari, yes, but you'll need another train ka ticket bhada and then catch the train again to come back.
And the risk is the same.
The risk is the same, probably more, because the tissue is not the same anymore.
Right.
So as a result of which there would be significant risks associated with that. So all in all, decide at leisure, don't decide at haste. Don't just jump off the cliff.
Right.
Figure out whom you want to go to, what are you trying to achieve. Figure out for yourself whether you're getting addicted to it, whether you're the 1 cigarette a day types or you've gone to the 100 cigarettes a day type. Figure out what your comfort area is, what works for you, what doesn't work for you. I don't think it should be in our domain as doctors to push anyone for surgery. We should just tell people that it's available.
Okay.
If you don't have hair and you wanted a hair restoration surgery, it's possible to do it. It might even be possible to grow your hair through non-surgical means. But whether to get it or not, who are we to tell you?
It's up
If
to
you think that bald is in, Sean Connery was amongst the best looking men on the planet. Who am I to complain? Or who am I to tell you what to do? So that's, I think, what we should do. Unfortunately, when there's an industry, everything doesn't go in that ideal way. There are people who are all coaxing and trying to get procedures done, and peer pressure mounts. Those are some of the problems that you have with social media around. Think of it this way, Sheetal. Imagine the people who are like 10 or 15 years old now, and they are getting addicted to their phones and social media now.
Absolutely.
At least with all of us, the advantage was we had social media in a big way when we were past 18.
True.
For them, it might not be true. Imagine the damage that social media might be causing on a young child's mind. So that is why the misuse of technology has to be taken care of. Otherwise, why cosmetic surgery? Everything will become a problem for individuals.
Yeah. Wow. You just mentioned surgical and non-surgical, right? So just as a layman, for anyone to understand, what is the difference between these two?
Surgery is cutting open the tissues.
Okay.
So let's say someone has a crooked nose.
Okay.
Surgery is cutting open the nose, setting the bones right, straightening them, putting a plaster and fixing it. So that's a surgery. The advantage of a surgery will be, well, if the results go well, the results may be permanent, it may last for life.
Okay.
Right? The problems are obviously if there are any complications, they also may last for life, right? It's a one-way ticket, one way or the other, right?
Yeah.
So the risks are more, but the benefits are more. The costs are more, but the results last longer.
Right.
So on the same person, suppose the crookedness was not so much.
Okay.
Then you could probably get away by just putting nose fillers at the top. And you might have seen, I don't want to name them obviously, but a few friends of mine who suddenly have very big chins which have come up. People are contemplating and thinking about whether that's a chin implant. May not be. It might just be fillers in the chin and fillers in the nose. Right. The advantage of fillers is it's an office procedure. You're going to your doctor's clinic, you're literally getting fillers. Next day you can move around. Surgery takes time to heal. Surgery can sometimes take, for a nose surgery, even 1.5 years for the swelling to completely come back to normal. With a non-surgical procedure, it's more instant glory, but the results will fade away in 2 years or so. Right. That may be the yin, that may also be the yang and the good thing about it. Right. So that's the difference between the two. You could literally go from surface procedures done on the skin. Okay. You could do procedures under the skin, which could be injectables. Okay. Or you could cut the skin open and set things right and sew the skin together. That's what we mean by surgery as opposed to non-surgical procedures.
Yeah. So maybe like a lip filler just lasts for like a
2 years. One and a half to 2 years is what it will last for. Right. Depending again on the type of fillers that you're using, of course. Right. But 1.5 to 2 years. The risks with a lip filler are very minuscule. Yeah. Probably less than 0.0001%. Whereas if you put in an implant, now suppose you put in an implant, like our famous friend who once had undergone a lip implant. Now if you've undergone an implant, people kept asking, she knows she looks funny. Then why is she starring in all of these movies and why doesn't she take it off? Because it wasn't a filler. It was a lip implant. Right. It was a surgical procedure where an implant had been put in. So imagine the trauma of someone who's got a lip implant, is now in a permanent state and has to undergo another surgery and another cut to remove it.
Oh my God.
So that mental state, already you're suffering, people are making comments. I mean, these people are intelligent people. Yeah. They would be hearing this noise everywhere. And then how do you go ahead and coax your mind to go for another surgery to remove that implant? So those are some of the challenges. So what we suggest in such cases is, कि अगर sure नहीं हो, don't do the surgery. Do something non-surgical. Do something reversible. कि अगर पसंद नहीं आए और एक इंजेक्शन डाले फिर से सेम जगह पे आ गए. But let's not be in a situation where you do something in haste and regret at leisure.
True, true. You know, I think I recently read about one of the cases that, not going to name anyone, of course. So someone in particular wanted a snatched waist, okay? So they got a rib removed. Is this like true?
It's true.
But
it's true.
Oh my God.
So the lower 3 ribs are actually residual ribs.
Okay.
Your rib cage, the lower 3 ribs extend only on the back side.
Okay.
And you can actually remove those to make it narrower. But again, is that intense? I don't know. For me as a surgeon, it's intense.
Right.
For me as a surgeon to turn around and say, I'm going to make an incision and actually break the rib off so that this guy can have a smaller waist is a little bit too much for me.
For anyone.
But at the same time, it's not my job to judge.
Right.
It's not my job to judge who should be doing this procedure. If someone feels confident about doing it, find a doctor who's able to do it for you. And if the two of you can meet, so be it. Let life coexist. Will I do it? No, we don't do it. So in such cases, we try and explain to people, look, it's also this, right? If everyone on the planet started looking the same, imagine, Sheetal, what a boring planet it would be.
I know.
It's because we all look so different. It's because all of us have a different texture to our skin that the world is interesting.
True.
More and more, unfortunately, now when I look at the millennials, when I look at the Generation Z, I have women who are like 18 years old who are all looking literally the same. If I've seen 3 of them and I see them on alternate days, I'm like, now which one were you? Because you're looking the same. Because everyone's trying to look the same way, which I think is a real shame. So I don't think we should allow that pressure to get to us. And I think that's where coaching, counseling is important. Don't go so far that you're not able to come back. Imagine you took those ribs off. And imagine those ribs were there for a particular reason, which is protecting your internal organs to some extent, whatever was being done. And then you wanted it back. Let's say you came back and you say, want it back. You can't have it back.
You can't have it back.
It's gone. So that's the thing. That's where I would draw the line and say कि नजदीकी फायदे के लिए दूर का नुकसान मत कर बैठना. That's what it is.
And this particular thing, the ribcage one, I'm sure it does have a health scare to it. As you said, right? It is protecting.
It could be safe. It could be safe. It depends because everyone's organs lie in slightly different areas. And you might be able to get away with removing 2 ribs. They might actually be accessory and may not be doing even any organ protection. But how far do we go down this path? And of course, every single day that we are discussing all of this, we are going further down the path. Today, it might seem really far for either of us, even me as a doctor or you as a consumer. But maybe 10 years down the line, it's become so common that everyone's undergoing it. We are not even thinking about it. So what might be good today may not be good tomorrow. What may not be good today might be good tomorrow. We don't know the answer to that. As of today, I still think it's an overkill. I still think it's too much to do, and I don't see the reason behind it. Everyone doesn't need to have a 23-inch waist. It's unnatural, it's not necessary, and actually it's the proportion between your waist and your hip, or the waist and your bust, which basically gives you the shape. I mean, if you were 23 all over and look like a pillar, that's not really the best thing to be in any case. It's the curves which make us run, right? So I'm not sure that's the ideal way of doing it, but to each his own.
But Debraj, it's so nice that you as a doctor are telling us about all of this, because usually when you meet doctors of any kind for that matter, they always promote their product or their service or whatever, because of course it's their business, right? But you are giving us like a truth bomb saying that this is good, this is not good, which is so fantastic. So thank you for that. I want to understand, like I mentioned earlier, is there any side effects when it comes to surgical and non-surgical cosmetic surgery? I'm not talking about the failures that happen, but side effects, health per se.
What would you mean? I mean, can you give an example
like
of
the rib thing, right? It could be
that's
a health
extreme,
right?
Let's talk about a nose cosmetic surgery. Okay, what are the side effects that you would expect?
I don't know, maybe internal.
If the nose has been done well, you would possibly breathe well, you would possibly have a straighter nose, and it could last all your life. The problem is most surgeons and many patients don't know where to stop. So as a result of which, you will have celebrities like this A-list star for instance, who's had multiple rhinoplasties, and as a result of having the rhinoplasties, now you can see the nose is looking completely different. The nostrils have begun to get flared, and that is a overkill which has been done. You may not have noticed it, but if you go from the first movie almost 2 decades ago to now, you'd be able to see how the nose has changed character every single year, every single movie. So like I said again, your nose was supposed to breathe for you throughout your life. Don't try to make it so narrow that over a period of time, the nose can't maintain its structure. The nose is supposed to breathe half a liter of air when you're at peace and 5 liters of air when you're on the treadmill. It needs to be able to expand to do that. If you're not giving it the chance to expand and be stable, then I think it's a problem with cosmetic surgery. But again, there are lots of doctors who are very on the face and who will tell people exactly as it is. So I have met some wonderful doctors, maybe because I know doctors of all kinds, who have been very clear that don't do this, this will have these side effects, and this is the way I'm going to do it, I'm not going to listen to you. But the thing is, obviously our profession too, just like any other profession, maybe having 10% people who are too commercial. That's the nature of things. I mean, if there are good prime ministers and bad prime ministers, there's no reason why there shouldn't be good doctors and bad doctors. We don't necessarily come from Mars. So there will be a certain segment who would have been bad probably in whichever profession, and they end up being too commercial as doctors. But I would like to believe that many of us are not that way, and we would tell the patient what it will actually entail. In fact, just on the subject of nose surgeries, our rhinoplasty consent, which is what nose surgery is called, is 25 pages. 25 pages. To the extent that you would actually read through every possible side effect. Not only that, we would tell you at the end that if general anesthesia goes wrong, you would die. You could die. That's the truth of the matter. You could die. I mean, you go in an aircraft, you may not die, but you could die.
You could die.
You could die is the truth for most things in life. So
life.
that actually gets signed off on a consent. What we do owe to our patients is to make a procedure look like a procedure and not make it appear like granny's magic pill. You'll go in for surgery and you'll come out having a new nose. It doesn't work like that. And that's what needs to be said in a transparent manner, irrespective of whether the person undergoes surgery or not.
Wow, that is amazing. Lastly, I just want to understand one thing. With the future advancement in technology, what is something newer, even advanced care or surgery that we can expect? I'm sure you as a doctor know. We as consumers probably don't know. So any insights on that?
If you were born in 2040, I am willing to bet you would live more than 100 years of age.
Really?
I am willing to bet on that. More than 100 years. So you'd be around till 2140 from 2040, because technology, medicines, food, etc. will have increased to that level. So 2040, if you were born, you would be 21, living till 2140 at least, right? And in 2140, you'd look 30.
Seriously?
Yeah. So, at 100, you'd look 30. That's the technology explosion which is occurring. It's exploding on us. Believe me, as doctors who are super specialized, imagine I practice only facial cosmetic surgery. My American board certification is only in facial cosmetic surgery. Face पे करने लायक 6 या 7 surgery होंगे. That's all that I'm doing, right? और वो 6-7 surgery, you're doing it throughout your life. So imagine the amount of super specialization in medicine, and even in facial cosmetic surgery. If I have to stay abreast of every nuance or every change or every push forwards that science is achieving, I have to run really fast on the treadmill just to stay in the same place year on year. So that's how technology is expanding. That's how quickly technology is just going to the next level. And so my wish for you would have been be born in 2040 and at 2140 look 30.
Yeah. Oh my God, when you said 100 years, I just remembered one thing, that I read the book Ikigai, talking about people in Japan.
I loved it.
Yeah, it's such an amazing book. But I want to understand that people in Japan, they say that they live for 100 years, like right now, as we speak in 2024, right? And that's just by, of course, mental well-being. They eat well, they exercise, and they're just happy from within. But they have not like mentioned anything about surgery. And generally also when we look at people from Japan, they have such good skin. It's called glass skin, right? So what are you suggesting? Your smile is definitely suggesting something else, but is it natural?
Japan and Korea are possibly the highest in terms of cosmetic surgery globally. Yeah, so everyone undergoes cosmetic
Right.
surgery, right? Except for the sunrise and the sunset, everything else is probably due to the cosmetic surgeons. That's the truth of everything. The thing though is, okay, what's the average life expectancy in India?
I'm guessing 60 to 70.
68
60,
is what the
yeah.
government tells us.
Yeah.
But 68 is because they're taking the entire population.
Right.
You must understand that in India, 25% of the population would be at the bottom of the pyramid.
Yeah.
If you remove the bottom of the pyramid, you remove people at the middle of the pyramid, then you'd get 50% of India. I am willing to say that 50% of India, which is middle class and upper middle class and people who are doing well, would have a life expectancy of around 82 years.
Yeah.
Right?
True.
So we are also at 80 years. We've gone from 40 years almost at the time of independence, and 75 years later, we are almost living double the age that we are living. So clearly, science has taken a quantum leap. Japan, they've been very lucky in some ways. They have a smaller population to manage. They have less problems than we do, but we haven't done too badly either. So
Yeah.
even in our country, from 80 to 100, if you've gone from 40 to 80, from 80 to 100 may not be that long.
That long, yeah.
So you might actually be able to live 100 if you were born in 2140.
Too ambitious. Anything that you want to tell all our viewers out there as a concluding statement from your end?
I think being natural and being who you are is the most important. I think we owe it to all of ourselves to be best versions of ourselves. If cosmetic procedures can help you become the best versions of ourselves, the technology is available. You could go and consult the surgeons or the dermatologists and figure out how you would want to take that journey forwards. But please don't get obsessed with it. Don't get obsessed with your looks. How you look is possibly a gift from nature, and just try to do whatever you can with whatever you have. I mean, honestly, don't get obsessed with it, because the 1% which does get obsessed with it pays a very heavy price.
Yeah. Thank you for such an amazing
Thank you, Sheetal.
conversation.
Thank you.
So
Thanks
much.
for having me here.
Anytime. Thank you.
Hi, this is Dr. Debraj Shome, and you're watching me on Pinkvilla.